Hey everyone, today we are going to cover pulmonary embolism, where blood clots travel into the lungs. So let's break it down. Pulmonary embolism is an obstruction of pulmonary arteries by an embolus. So most commonly a venous thrombus from the legs or pelvis breaks off, travels through the inferior vena cava and lodges in the lungs. So this blocks blood flow and strains the right heart. So the key risk factors are immobility, like long flights and or bed rest. So recent surgery, especially orthopedic, and pregnancy and postpartum and inherited hypercoagulability disorders, cancer and oral contraceptives, and prior deep vein thrombus. Think of a virtuous triad. So there will be stasis, hypercoagulability, and endothelial injury. So clinical presentation would be pulmonary embolism ranges from asymptomatic to obstructive shock. So the classic triad would be dyspnea and pleuritic chest pain, and cough with possible hemoptysis. Also tachycardia, tachypnea, and hypoxia. And critical point symptoms are non-specific. So considering pulmonary embolism in all acute dyspnea patients, especially with risk factors, so maintain high clinical suspicion. So diagnosis would be CT pulmonary angiography. So that's the gold standard. So directly visualizes the clots, and D-dimer is highly sensitive, and negative rules out pulmonary embolism in low-risk patients, but positive is non-specific. ABG may show low partial oxygen and respiratory alkalosis, or it can be normal. ECG shows low partial ECG would show tachycardia, and sometimes S1Q3T3 pattern. So using Wells and Geneva score for risk stratification. So treatment would be for stable pulmonary embolism, therapeutic anticoagulation with DOACs like apixaban or rivaroxaban, or low molecular weight heparin bridged to warfarin. So duration is 3 to 6 months minimum. So for massive pulmonary embolism with hemodynamic instability, thrombolytic therapy with TPA to actively dissolve the clot. If contraindicated, use catheter-directed therapy or embolectomy. So this is an ICU emergency. So pulmonary embolism maintains high suspicion, anticoagulate stable patients, and thrombolyze massive pulmonary embolism. So if you find this useful, please hit that like button and subscribe. Thank you.